For my personal resilience, I decided I'm not going to have any slides because every time I try and do PowerPoint in a conference, it goes wrong. So I just haven't done any slides and I'm keeping it simple for myself. I'm going to start by sharing something that's not from CTA at all, and I hope you'll forgive me for that. This is a vision that was co-created by members of the Social Care Futures movement. And if you haven't come across Social Care Futures before, they're an incredible group that is convened with individuals who draw on support to have active and fulfilling lives, and people who are involved in giving that support. And they're an incredible bunch of people. They come from all over the UK and all over the world, in fact. And their vision, which they put together across all of their individuals, was that we all want to live in the place we call home, with the people and the things we love, in communities where we look out for each other, doing the things that matter to us. And I thought I'd share that as my opening statement, because when I think about well-being, that really sums up for me what well-being feels like. And I've been very fortunate. I've worked in access and inclusion for about 15 years now. And I think of the people that I've worked alongside who have demonstrated what well-being looks like and sort of epitomized well-being for me, those are people who are living that kind of life, who have access to the support that they need in order to be independent and interdependent, connected, and feeling part of a community. So I think for me, that's part of why I thought I'd share it as my opening statement, really, because I think wherever we are on our own personal journeys, older people, younger people, living with dementia, carers, it's a vision that certainly I feel like I can get behind. I thought I'd also tell you a little story about one of the individuals that accesses support provided by one of our members, because I think sometimes those are the stories that resonate for me when I come away from an event like this. So I'm going to start by telling you about a lady called Annie. I would imagine that many of you will know an Annie or a Beryl or a Fred or a Mary, or someone whose story will resonate alongside this. But this Annie is in her 80s. She's lived in the same community, a steelworking community, all her life. She's seen that community change radically over time. Need a third hand. Lots of people moving in and out of that community, young people in particular leaving that community, industries disappearing over time, and the town centre, unfortunately, becoming a shadow of its former self. At the same time, Annie's health, particularly over the last 10 years, has deteriorated. Her eyesight has become much less reliable. She's had to recently swap from using a walking frame to using a motorised wheelchair. And the bus services in the area where she lives are incredibly limited. Annie recently was told by the local taxi company that they weren't going to be able to pick her up anymore because the law has changed and they're not allowed to come and help her out of the house into the taxi anymore. And Annie knows that the law hasn't changed, but she also knows that the young man who works in the office isn't going to listen to her because she's an old lady. So there is a very real risk that without community and without connection, Annie's life is going to become progressively smaller, more disconnected, and much more lonely. I think reflecting on the conversations I was having over dinner last night and conversations I've been part of, hearing Charles speak this morning, hearing Helena speak this morning, what really strikes me is the fact that community is about a lot more than place, although place can play a really important part in community. In a similar vein, when I talk about transport, I always say that transport is about so much more than just a journey. When it works well, it's about safety, community, independence, and connection. Connection is absolutely fundamental, I think, to our well-being, and as individuals and within our communities as well. For Annie and thousands of people like her, we have an enormous opportunity through transport to foster more of those connections. So the Community Transport Association, if you haven't come across us before, we are a membership body, we're a support organisation, and we work alongside a network of community-led, community-powered transport providers. And that varies really widely across Wales. So we have organisations that are very small, sometimes not even organisations, groups where neighbours will support each other to get to and from the hospital or get down to the hairdressers at the weekend to make those connections in a way that is meaningful and powerful, empowering, I think. We also have large bus operators who run dial-a-ride services that help people get to the shops every week or to connect you, in a way that the commercial bus services once upon a time would have done. We've got services that are everywhere in between those two ends of the scale. So we have organisations that rent e-bikes and mopeds to young people to help them to get to college or to start their first job. We have organisations that support active travel and specialise in working alongside disabled people or older people or people with dementia. Basically, for us at CTA, our work is underpinned by our vision, which is of a world where everyone can access transport that meets their needs. And our argument when we talk to people in Welsh Government and local authorities, health boards, people who hold the power and the budgets, is that transport is a fundamental part of the gateway infrastructure that allows us to live good lives. And when we think about our well-being, we need to think differently about how we do transport in order to enable that to happen. Over the last year, we've been doing some research through our members and through our network. And what we found is that the community transport sector in Wales is extremely strong. So we have a network of more than 100 organisations that deliver this kind of transport out in the community. More than 80% of them have been delivering those services for more than 20 years. And they deliver on average at least 750,000 journeys every year. But just in the conversation I had last night around the dinner table, there's an awful lot of people that have never heard of community transport. And that's something that we want to change. We are trying very hard to influence the way that decisions are made around how buses are funded and what our transport networks look like. And the argument that we're trying to have with Welsh Government and Transport for Wales particularly is that the mainstream transport network doesn't meet people's needs. We know that there are lots of older people, lots of carers, lots of people with learning difficulties, lots of disabled people, lots of people living in rural communities, lots of people living in poverty that cannot make those connections. It is not physically possible, and some of Charles's maps just illustrated that really, really clearly. So we would like Welsh Government to think about the example that's set by these really effective community-led organisations that have been delivering successful services for 20 years or more, to think differently about how they see community and about how they make decisions that influence ways in which people can make those connections. What I'm hearing from my team, the meetings where they don't send me out into the community very often anymore, but when I do get to go out into the community, what I hear is that the need is very, very strong and it continues to grow. Our public transport network is fragmented, expensive, and frankly inaccessible for an awful lot of people. Now, we do have an opportunity at the moment. So the Welsh Government published a Wales transport strategy called Llwybr Newydd in 2021, and that sets out a grand vision of what the transport network could look like. And it's very much geared towards a connected, integrated, sustainable transport network that puts people before profit, which absolutely I'm 100% behind. We're very supportive of it. We were very, very pleased to see community transport listed in there alongside all the other more traditional mainstream modes of transport. What we're not seeing yet, though, is the action that needs to happen to make that change. We have the policy framework now, and community transport shows what is possible, what could be done. A couple of examples to just highlight for you why we think this could work and why we think this is really important. So transport to health is something that Helena and Charles both mentioned. It's a real barrier, especially for people who have additional support needs. Non-emergency patient transport is a statutory responsibility. If you need to get to the hospital, the government have a legal duty to provide transport for you, but there is no kind of set a service level agreement in terms of how long you're going to spend on the bus to get from your home to where you're going for your appointment. So if you live in rural Wales, you might be picked up at 7 o'clock in the morning for an appointment that doesn't start until 1, and then you have to hang around in the hospital until 6, and then have another 2-hour journey to get yourself home again. And that's if you're eligible. That's if you don't have the need for a carer to come alongside you, because if your carer is with you, they're not eligible for the bus, so they can't travel. Now, community transport sort of leapfrogs a lot of that. Thank you. So we have a brilliant project. We work alongside a network of 11 organisations with funding from the Aneurin Bevan Health Board, which provides a little investment of additional funding to create additional capacity. And our community transport organisations have really targeted that investment on supporting people who are experiencing those transport barriers. And that's helped people experiencing homelessness, who are older, people who have disabilities, people who are experiencing a sort of intersection of discrimination. And that small amount of investment has made an enormous difference. So we want to use that example in the conversations that we're having with Welsh Government and with local authorities and with the other health boards around Wales, North Wales being a particular priority area. We know that it can be better than this. So let us work with you and support you to improve it. Another example, much more close to home, on Ynys Môn, there's a huge number of community-led and community-powered organisations and groups who provide incredible support locally to their neighbours. Now, Arriva would tell you it's because of the 20-mile-an-hour limits. There's been a big reduction in bus services, leaving a lot of people stranded, and that network of community-led organisations is coming together, and the local authority is actively trying to create opportunities for investment to empower those community-led organisations to step forward and to do more and to provide more of those connections. So we know it's possible. We know that there are ways of distributing funding differently that really values the way that all of us want to travel, not just your commuter who's getting from A to B. All of us have value. All of us want to make journeys. All of us want to connect with our communities. We all in this room, and I think certainly with the vast majority of the conversations that I'm privileged to have, want Wales to be the best place to live, the best place to work, the best place to grow up, and the best place to grow old. And connection to your community is fundamental to that. So if we can amplify the voice of Welsh people collectively, we think we can push decision makers to think differently. For older people, people living with dementia and their carers, it really can be the difference between being a part of a community or not. I believe that we've got a once-in-a-generation opportunity to deliver and be part of delivering something that really works. Later this spring, we'll be publishing a report which we've called No One Left Behind, which is an interesting connection back to Older People's Commissioners team. It's based on the research that we've done with our network, and we're going to be making a set of quite strong asks of Welsh Government, local authorities and health boards about how we think things need to change. We need the Welsh Government and Transport for Wales to learn from the successful examples that are set by our network. That's not the right one. It's on the back. This is what happens when you rewrite it at 5 in the morning. If you'd be interested in finding out more, this is my sort of call to action bit, I suppose. We want to be part of a bigger and more powerful network. We know as a small charity that is working nationally, we only have a certain amount of influence. And we also know that all of you are connected with people who need transport, can't get it, have transport, are worried about the future, currently drive, thinking about what might happen if they're not able to drive when they get older, perhaps married to someone who's experiencing dementia and always been the one that's driven the car, moving to a place where they're closer to family, but don't necessarily have the same connections to their local infrastructure. So when we publish this report, what we'd like to do is just connect with as many of you as possible and share that report with you and with your networks. And if you'd be open to having a conversation with us about ways in which we might be able to work together, come and have a conversation with me or my two colleagues who are helpfully both called Michelle, so it's one less name to learn. We would love to have a chat with you about ways in which we might be able to come together and increase the power